addressing the problems of insulin-resistant syndrome. This video is provided for the seeing impaired and those individuals who prefer an audio and visual presentation.
Hello, my name is Dr. John W. Tyndall and I have been in private practice for almost 30 years. Since mid-2007, I have seen some amazing results obtained for patients and myself concerning metabolic disorders. Specifically, those involving insulin resistance problems. Let me tell you my metabolic health story, which may help you understand how great I know this product is. I say this from a doctor's viewpoint and as a patient. About 30 years ago, I had a vascular accident, which is better known as a CVA. While speaking at a lecture, I suddenly lost almost all motor control on my right side. I also experienced numbness from my right side of my face to my toes. My speech became unclear and slurred. I reached the point where the audience did not understand my speech. And needless to say, I had to sit down before I fell down. Yes, I survived. But it left me with some permanent damage. Since that incident, when I would overwork and get tired, my right side of my body would have a sleepiness sensation. I also had major problems working with my mouse at the computer. When I would try to move the mouse from left to right or right to left, I would have to use my left hand to hold down my right hand to make it still, so I could move the cursor on a spot without it running all over the page. Another side effect, I didn't have a blood pressure problem before this health crisis occurred. But I sure did after that horrible incident. The cardiologist stated he did not know why I had the blood pressure problem after the incident. How far-reaching are the benefits of this incredible formula? I believe I have only touched on the possibilities of helping different patients with all kinds of health problems. I was born with asthma and basically lived at the hospital for the first 6 years of my life. I started getting chiropractic care at 14 and saw a tremendous improvement in my breathing. But, since starting with what I call a new health rejuvenation product, my breathing overall has been benefited even more than I had seen in the past. I truly believe everyone needs to use this product. I'm pleased to tell you, after taking a newly released herbal formula imported from China, which by the way has only been available in the last 2 years to American physicians, which is doing some great things for many other people, including myself. After only 3 weeks using the wonderful product, my blood pressure is starting to be normal again after almost 30 years. That crazy mouse problem with the computer has drastically reduced to the point of only one hand to do the movement now without going all over the page. In fact, at 60 I not only feel great, with very high productive energy, but I continue to see improvements on a daily basis. My blood pressure, with the same medication that I have used for almost 30 years, would normally never be better than 155/90, with a pulse rate of 90+. After only 3 weeks of using this product and the same medication, my blood pressure reading is now, get ready for this, 148/65, and my pulse rate is 66. I know at this rate of improvement I will probably be off the medication completely in 4 to 5 weeks. It is also important for me to tell you, I'm not one of those people with a high glucose, or better known as high blood sugars. My blood sugars are only 90. So, just because you may not have a blood sugar problem, does not mean you do not have an insulin-resistant problem. I'm a perfect example of that. From a financial standpoint, I estimated that over the years of taking the one medication, my out-of-pocket expenses were close to $12,000. So, please, listen to what I'm going to tell you. It may save your life or someone you love from early death or possible disability. If your metabolic health is not very good right now, or you could be one of the 3 Americans that may not be exhibiting any of the symptoms of the condition yet. Regardless, if you have the time to turn it around, maybe this product will be a blessing for you, as it was for me. The following educational information is for those people whose health problems are related to being unable to regulate blood sugar levels or have insulin resistance disorders, specifically type 2 diabetes, hypertension, arteriosclerosis, cardio and craniovascular diseases, abnormal cholesterol or triglycerides, high blood pressure, obesity and any other microcirculating deficiency condition. What is insulin resistance? Insulin is a hormone that is produced by the beta cells, which are cells that are scattered throughout the pancreas. Insulin is an important hormone that has many actions within the body. Most of the actions of insulin are directed at metabolism to controlling carbohydrates, such as sugars and starches, also fats, and proteins. Insulin is also important in regulating the cells of the body, including their growth. Insulin resistance is a condition in which the cells of the body become resistant. As a result, higher levels of insulin are needed in order for insulin to have its effects. What causes insulin resistance? There are probably several causes of insulin resistance, and there is thought to be a strong genetic factor. Some medications can lead to this resistance. In addition, insulin resistance is often seen in the following conditions: metabolic syndromes such as obesity, pregnancy, infections or severe illness, stress, using steroids, either prescriptions or illegal drugs, and poor diet. Diabetes mellitus has become increasingly prevalent, so much so that it is, in fact, currently referred to as a national affliction. Type 2 diabetes, which accounts for about 95% of diabetes mellitus, results from insufficient insulin secretion and insulin resistance, in which insulin cannot be used effectively. Stress, overeating, lack of exercise, and other modern lifestyle habits play a large role. These predisposing factors promote the formation of the diabetic constitution, which is characterized by metabolic and circulatory disorders. I mentioned to you before about national affliction. This is based on the fact that 1 in 3 Americans may already have what is called insulin-resistive syndrome. After a meal, non-diabetics store approximately 40% of their glucose in the liver before being distributed to the blood as required. People become diabetic if there is insulin resistance caused by functional decline or disease of the liver. All type 2 diabetics suffered from minor functional disease of the liver, such as fatty liver, and slow flow of blood and bile. When these minor functional diseases of the liver are treated, metabolism accelerates. One of the major problems that I see with patients, especially women with slow metabolism, have weight problems, which may be why they have such a problem in losing weight and keeping it off.
Testimonials: a 62-year-old man. This patient has had 2 heart attacks. In November of 2007, he had several tests ran for his 3-month checkup, and the doctor said his whole right side arteries of his heart were blocked. The doctor scheduled surgery for January 18, 2008. Meanwhile, in November of 2007, Dr. Tyndall recommended that he take Ketsumeisei for 2 months. He was doing nothing different than the Ketsumeisei. He then went in to have his surgery done, and they cut him open and said there was nothing wrong. His arteries were perfectly clean, sewed him up and sent him home. Before taking the Ketsumeisei, his blood sugars were between 160 and 170. After taking the Ketsumeisei for 2 months, his blood sugars came down to 125 and even down to 115. An 85-year-old woman with type 2 diabetes was diagnosed at 48 years old, and the patient had been treated with oral hypoglycemic agents. In April 1986, cataracts were diagnosed. She suffered from a cerebral infarction in October 2003, so an anticoagulant medication was added. At the time of examination in February 2004, she had partial paralysis of the left side, difficulty in speaking, and shortness of breath. Her fasting blood glucose level was 209, and the cholesterol level was 352. Following 2 months of treatment, her blood glucose dropped to 182, and the cholesterol level was reduced to 319. She also noticed improvement of her breathlessness and numbness of the extremities. She has continued to take Ketsumeisei for over 3 years, and at present is able to walk again and can even talk on the telephone. Her present blood glucose level is 136, and she has stopped using any anticoagulants. Would you like further information regarding your health problems? And if Ketsumeisei may help resolve your conditions? Call Patty at World Nutrition. She is Dr. Tyndall's nutritional consultant, and she will be happy to answer any of your questions. 1-800-548-2710, extension 149. That's 1-800-548-2710, extension 149. Please understand, this product is only available through healthcare professionals, so when you talk to Patty, you must tell her Dr. Tyndall has recommended the type 2 diabetic formula.